Greetings. I'm going to be covering my portion of the topics for the final exam to see if that will help you. I have quite a few on there, so let's study hard, concentrate on this content, and do well. Okay, so let me get my face off here. I threw together my topics here, so we'll be able to look at them together. Final exam topics from my proportion. Here are my topics for the guide. Number 1. Closure of the fontanelles. 2 questions. That's what that 2 means. Well, there's the anterior and the posterior. So I would go back and review when those closed. And that's it. Normal pediatric vital signs. Be sure to get out your sheet that goes over those normal pediatric vital signs. There were 4 age groups. Remember, the heart rate started at 140 and went down by 20. The respiration started at 40 and went down by 10, except for the last time. So make sure you look over that. Terminology related to pre-conventional stage. That terminology is like anonism. Know what that means. You bad, bad, bad table for hurting my child. Giving lifelike qualities to innate objects. Transductive reasoning. One nurse in a white coat inflicts pain. All nurses in a white coat inflicts pain. Magical thinking. My brother was mean. I wish something bad would happen to him. It really did, and I didn't want it to. Even though it was an accident, they will think that it was because they were mad at them and thought something should happen. 2 questions from this section. Make sure you know the difference in that terminology. Tylenol dosing. Know your normal Tylenol dosing. 10 to 15 milligrams per kilogram every 4 hours. Theorist. 3 questions on those booger bear theorists, so make sure that you know them. Levels of prevention. 1 question. Secondary. You should have thought screenings. So primary is when you try to prevent something from ever happening. Immunisations would be an excellent example. Secondary, any type of screenings are secondary level. Tertiary is once something has already happened and you step in and try to prevent anything further from happening or to try to help them heal, like rehab after a stroke. Immunisations, 1 question. It'll be a general question like they came in for their 4-month visit. Which one of these would you expect them to receive? Which immunizations? Normal weight gain throughout infancy. Okay, I know the normal at birth, the normal at 6 months when they double, and when they triple at 1 year. Tanners. I would get back out my little handy dandy handout that I gave you on tanners, and I would know tanners inside out. Interpretations of ABG is my favorite, and then 1 priority question related to that. 6 of these, okay? So 5 interpretations, 1 priority question. So if you are really good at interpretations, don't worry about it. If you're not so good at interpretations, go back and review that. Types of immunity, 2 questions. There's active and passive, and artificial and natural. So there's only 4 choices, and there'll be 2 questions. Make sure you understand all of those types. Absolute neutrophil count, 1. Make sure you remember the formula. Total white blood count, the bands plus the segs, times the white blood count, divided by 100. So it's the total white blood cell count plus the bands plus the segs, divided by 100. Total white blood count times the bands plus the segs, divided by 100. Diagnosis of AIDS. How do we diagnose AIDS? What is the criteria for that? Okay. Transmission of HIV. How is it transmitted? Go back and look at all the ways that it's transmitted. A good select all that apply. Hypersensitivities. There were 4 major types. I will give you prototypes. Know which one they belong to. So be able to match up your examples with their type of hypersensitivities. Antibodies, also my favorite. IgE, IgM, IgD, IgA, right? And IgG, the giant. So make sure you know those antibodies and when they would go up and what they're responsible for doing. There'll be 4 photos of childhood infections. 4 photos of childhood infections. You can go back and review your Jeopardy. And then no lab and pinworms. So when you have pinworms, what lab would you expect to be elevated? Okay. What lab would you expect to be elevated? Eosinophil counts are elevated 2 times. Allergies and parasites. Okay, that's my section. You should do well. If you have any questions or concerns, don't hesitate to contact me. Thanks and have a good one.